A person dies by suicide with a firearm in the United States on average every 22 minutes. That is a stark and uncomfortable fact. It is a quiet alarm that rings more than 60 times a day, often unheard in the noise of our national conversation. This is just one thread in a complex tapestry of struggle that defines life for millions of Americans. These are not distant problems happening to other people, in our towns, on our streets, inside our own homes. The United States is a nation of immense wealth and innovation, yet beneath that surface, a hidden crisis festers. This essay is not about charts or complex data. It is about people. Gun violence is a uniquely American epidemic, a public health crisis that unfolds not in a single, catastrophic event, but as a relentless, daily tragedy. It's a drumbeat of loss that has become a grimly familiar feature of our national landscape. Each year, tens of thousands of lives are extinguished by firearms. Thousands more are left with life-altering injuries, both visible and invisible. These are not just statistics. They are stories cut short, futures erased in a flash of violence. They are parents, children, friends, and neighbors. Consider James, a young man from a quiet Midwestern town. He was 22, working at a local factory, saving for a small house with a yard. He had dreams of coaching his future kids' soccer team. One evening, a single stray bullet from a dispute he had nothing to do with pierced the night air. It found him walking home. He died on the pavement before the first responders could arrive. His family was left with a void that will never be filled, a universe of what-ifs. Or consider Maria, a grandmother in a bustling city, the matriarch of her block. Her life was taken during a robbery at the corner store where she'd gone to buy milk for her grandchildren. The impact of these deaths ripples far beyond the immediate family, tearing at the very fabric of a community. The factory where James worked felt his absence. His friends struggled to make sense of the random injustice. Fear is a corrosive element. It transforms public spaces, parks, schools, movie theaters, places of worship, into potential sites of tragedy, forcing us to calculate risks in places where we should feel safe. The causes are multifaceted and deeply intertwined. The sheer number of guns in circulation, economic desperation, untreated mental health challenges, and a culture that sometimes glorifies violence as a solution. Each thread contributes to a complex and devastating tapestry. In one of the wealthiest nations on earth, a profound contradiction lies at the heart of its society. Here, access to basic health care remains a privilege, not a fundamental right. Millions are uninsured or underinsured, forced to navigate a bewildering labyrinth of deductibles and copays, where a sudden illness can easily mean financial ruin. Consider the story of Maria, a cleaner working long hours in a large city to support her family. One Tuesday, her world tilted. Her young daughter developed a dangerously high fever and a severe, rattling cough. Maria had no health insurance through her job, and she knew she couldn't afford the local clinic's steep upfront fees. With her daughter's condition worsening, she did what millions are forced to do. She took her to the emergency room, the provider of last resort. They entered a scene of controlled chaos, a system strained to its limits. They waited 7 agonizing hours to be seen. The care, when it finally came, was competent and kind. But relief was short-lived. The cost of the prescribed antibiotics was another barrier, another painful calculation. Then, the bill from the hospital arrived weeks later, a crushing multi-thousand-dollar blow. This is a choice no parent should have to make, the immediate health of a child versus the ability to pay rent and keep a roof over their head. This constant fear of medical debt leads many to delay necessary care, turning treatable conditions into chronic illnesses or emergencies, and ultimately leading to worse outcomes. These disparities follow predictable lines of geography and race, creating medical deserts in rural areas and underfunded hospitals in marginalized urban neighborhoods. Evidence shows that patients of color often receive lower quality care. Their pain is taken less seriously, their concerns dismissed, and their health outcomes are consistently worse. Fixing this requires bold, systemic change. It means creating universal, affordable coverage that detaches health from employment. It means robust investment in community health centers, in both rural and urban areas, that provide accessible, preventative care. and it means finally putting an end to the devastating practice of medical bankruptcy. Economic inequality in America has stretched to levels not seen since the Gilded Age, a period of dramatic industrial growth and equally dramatic social disparity. Today, a similar chasm has opened up, creating two vastly different American experiences. On one side, a landscape of gleaming luxury towers and unprecedented fortune. On the other, a reality for millions of families defined by a relentless struggle just to get by, where the American dream feels increasingly out of reach. Consider Rosa, a single mother of two. Like so many, she is determined to build a better life for her children. To make ends meet, she works 2 full-time, minimum-wage jobs, a grueling schedule that defines her existence. She is a home health aide in the mornings, providing essential care for the elderly. She is a cashier in the evenings, standing for hours under harsh fluorescent lights. She leaves before her children wake and returns long after they've gone to sleep. Her 70-plus hours a week barely cover rent and groceries. There is nothing left for savings, an unexpected car repair, or simple birthday presents. The cost of childcare alone consumes a staggering portion of her income, a burden shared by millions of working parents. This constant financial pressure creates a pervasive instability. Her children feel the stress, even if they don't fully understand its source. Security and opportunity are stolen, less time for homework help, no money for after-school activities, and the dream of college feels like a fantasy. This isn't just Rosa's story. Across the country, basic necessities have skyrocketed, especially housing. As workers can't afford to live where they work, commutes grow longer and more expensive. Precious time and money are spent in transit, communities fracture, and homelessness rises. The quality of public education often tracks property wealth, creating a 2-tiered system of polished labs on one side of town and classrooms with peeling paint on the other. The sobering fact is that the top 1% of Americans now hold more wealth than the entire middle class combined. This concentration of resources starves the systems we all rely on. But pathways to greater economic mobility can be built. Programs that offer job training for in-demand skills provide a ladder up, creating opportunities for better wages and more stable careers. Addressing inequality means restoring balance. It means advocating for living wages, ensuring access to affordable housing and childcare, and guaranteeing a quality education for every child, regardless of their zip code. Addiction is a disease that thrives in the shadows, shrouded in stigma and misunderstanding, often seen as a moral failing, but far more complex. Addiction is a disease of the brain, often beginning as a response to physical or emotional pain. Consider Paul, a construction worker injured on the job, prescribed opioid painkillers that eased pain and numbed anxiety about work and family. When the prescription ran out, the addiction remained. He turned to cheaper, more dangerous street drugs to avoid withdrawal. The impact on a family is like a slow-motion earthquake. Trust erodes, communication breaks down, finances drain. The emotional toll on children can last a lifetime. Yet there is hope. Recovery is possible, but it requires compassionate, evidence-based treatment. We must treat addiction as a public health crisis. Expand treatment on demand, invest in housing and job training, and end the stigma. These 4 crises, gun violence, healthcare gaps, inequality, addiction, are not isolated. They are a tangled web, each strand pulling the others tighter. Imagine growing up amid few jobs, underfunded schools, crumbling infrastructure. Despair fuels violence, and the turn to substances as escape. Trauma without care becomes PTSD, anxiety, depression, risk factors for future violence and substance use. Lose a job, lose insurance, lose treatment, downward spiral. Each crisis acts as a threat multiplier for the others. We cannot solve in silos. Solutions must be linked. Mental health with violence reduction, healthcare with equity, recovery with opportunity. Recognizing the web is the first step toward a healthier, safer, more equitable society. Faced with the scale of these crises, it is easy to feel powerless. But this is a dangerous misconception. Change often grows quietly from the ground up. Checking on an elder, making sure they have groceries and prescriptions, Volunteering at an underfunded school, helping a child learn to read. A local owner paying a living wage, forming a watch based on connection. Names shared, info shared, kids looked after. Advocating for safer streets and clinics. Perhaps the most powerful small act is listening. Ask, "Are you okay?" Then truly listen. Being a witness carries a responsibility to care and to act. While individual and community actions are essential, they are not enough. We must demand action from leaders and reform flawed systems. On gun violence, close loopholes, fund community intervention, support risk-based laws, measures most Americans support. On healthcare, commit to universal access. No one should die or go bankrupt for care. Invest in public health, mental health, and treatment centers. Everywhere. Create opportunity and restore dignity. Living wages, housing, skills, and a stronger safety net. Hope is an active choice, and we see it in quiet, tireless work every day. Stories of survival illuminate a path forward. Learn, volunteer, have hard conversations, then vote for empathetic, fact-guided leaders. The problems are vast, but not invincible.